never gonna stop. Do whatever it takes to get to the top. Cream of the crop. You step up, you gon' get dropped. Ladies and gentlemen, that's right. You didn't expect me to drop twice tonight, did you? You get a double gift tonight. So hit that subscribe button right now, because what I am about to reveal will make you think not once but twice about trusting your life to the so-called healthcare system. If you want to survive in South Africa, you need to know the shocking truths I'm going to tell you. And if you miss this, even by a second, you might be literally risking your life. Ladies and gentlemen, we need to talk about the elephant in the hospital room. South Africa's healthcare system is so broken that 1 in every 8 patients is critically ill, and over 20% of those die in 7 days. But here's the kicker. Most of these deaths are completely preventable. Think about that for a moment. You're more likely to die from our healthcare system than from many of the diseases you're trying to treat. Listen to that again. It's like going to a restaurant where the chef is more dangerous than food poisoning. Here's something that will blow your mind. We have a massive shortage of healthcare professionals, yet many qualified doctors cannot find employment. We are literally letting people die while qualified doctors sit at home, unemployed, stressing because they don't have a job. It's like having firefighters standing outside while buildings burn because of budgetary constraints. South Africa loses nearly 6,000 doctors and nurses every single year. I wish I was making those numbers up. That's 500 healthcare workers fleeing the country every single month. These are not just numbers. These are people who could save your life, and they are running for the exits faster than spectators leaving a Kaizer Chiefs match. The nursing crisis alone should terrify every single South African. We are short between 26,000 and 62,000 nurses nationwide, and here's what it means in real terms. Nurses face excessive workloads, leading to heightened stress, burnout, increased mortality rates, and preventable medical errors. Picture this. You arrive at the hospital with a heart attack. You just suffered from a heart attack. But the one overworked nurse looking after 20 patients can't get to you in time. You didn't die from the heart attack. You died from a system that was supposed to save you. Save you! Brace yourselves, because by 2025, we are projected to be short of 97,000 health workers. That's not next decade. This year, we are already living in the healthcare apocalypse. And most people don't even know it. Why? Because the mainstream media doesn't cover it. Let's be brutally honest about what's happening in our hospitals right now. We have understaffing kills, with skeleton crews trying to handle impossible patient loads. Mistakes aren't just probable, they're inevitable because the staff are just as human as we are. Instead of delivering quality services, healthcare workers can only deliver half or maybe a quarter of what's needed. Experience exodus too. Our most experienced healthcare workers are fleeing to countries that actually value their skills and don't treat them like garbage. We are left with overworked junior interns trying to handle cases that would challenge seasoned professionals. We have equipment disasters, the more infamous ones. Even when the staff are available, they are often working with broken or outdated equipment. It's like trying to perform surgery with a butter knife. I wouldn't be surprised if they actually do that. We also have administrative chaos. The bureaucracy is so dysfunctional that the South African Nursing Council is actually blocking the training of new nurses despite the critical shortage. If that's not insane, I don't know what is. They are literally preventing solutions to the crisis they're supposed to solve. Make it make sense. Your chances of survival depend on geography. Rural communities are being hit the hardest, having to skip medications for chronic illnesses as storms and floods batter clinics. But even hospitals are overwhelmed and under-resourced. But here's the most infuriating part. It's not that, it's this. Most deaths in our system are preventable. We are not losing people to incurable diseases or complex conditions. We're losing them to a system that simply doesn't function. Even in mental health, where 96% of women deliver in healthcare facilities, most deaths are still preventable. Poor pay has been linked to preventable deaths, with many practitioners quitting because they cannot survive on their salaries. Their salaries are BS. Have you seen the average salary of a nurse? We are creating a system where only the desperate or inexperienced are willing to work in our hospitals. And that's a death sentence for patients. The truth is, our healthcare system has become more dangerous than many of the conditions it is supposed to treat. Tell me if I'm telling lies. You're safer avoiding the hospital and hoping your body heals itself than trusting a system that's actively killing people through negligence, understaffing, systemic dysfunction, and negative thinking. We've created a healthcare lottery where your survival depends on luck rather than medical expertise. Will you get the overworked nurse on hour 16 of their shift? Will the equipment work? Will there be medication available? Embarrassing! Will anyone even notice if your condition deteriorates? While politicians promise healthcare improvements in every election, the reality on the ground gets worse every single year. Healthcare failures remain one of the main negatives holding South Africa's progress back. Yet we keep getting promises instead of solutions. And for some strange reason, you're not tired of hearing those undone promises. This is your wake-up call, South Africa. Our healthcare system isn't just failing, it's actively dangerous. Every day, we delay fixing this crisis, more preventable deaths occur under our noses. Every qualified healthcare worker who leaves the country takes potential lives with them, innocent and not. We need to demand immediate action. Proper staffing levels, competitive salaries, functional equipment, and accountability, for gosh sakes, for these preventable deaths. Most importantly, we need to stop accepting that dying from system failures is just how things are in South Africa. No, it's not. It's not U6 no 9. It's not. It's wrong. Share this video, tag your representatives, and subscribe for more truth about the crisis affecting every South African family. Because until we truly acknowledge just how dangerous our healthcare system has become, we can't begin to fix it. And people will keep dying from a system that was supposed to save them. Your life might actually depend on this. Share this video with as many as you can. This is the Sambit, and like always, I'll see you next time. And this is to the South African healthcare system or anyone part of the corruption. You are embarrassing.